really very impressed by your work, really enjoyed it, and hope I learned from it. The one thing that we can't learn from watching you is what your inner process is like during the session. Now, I'm interested in knowing how much you're thinking about what you're doing and planning it, and how much you just kind of flow based on your experience of seeing hundreds of families and just sort of move through the session.
Both. One thing is I enter into the room with a definition of the family in terms of developmental stages and family organization. This is a blended family, so I know that in a blended family I will get more of a history taken in the first session than in other families, because the history is a history that is complex, and because I consider blended families normal ones till I am told the contrary. So I see them as families that as organisms get together, go through trial and errors, and organize themselves and crystallize at certain level of flexibility. So my approach to them is, unless you demonstrate that you are not normal, I am in a position in which I can be a coach, a helper, but I will not consider that anything is serious. You will need to demonstrate that to me. So that is a way of entering. A way of entering in these families is also a supportive one. You are trying a difficult job. I know the difficulties of trying to couple at the time that you need to parent. It's an extremely complex operation. So I enter like that, and my first contact is trying to contact as many people as I can. So in terms of the way in which I work, I try to make contact with people, I try to be friendly, till I can create some situation in which two people can talk with each other, that are moments for me of disengaging and begin to look at processes instead of paying attention to content. So at the point in which I get people to talk with each other, then I begin to hear content and relationship messages. Then I begin to pay attention to the fact that the boy is touching the mother, pulling from the mother's thing. And I know that since that is the area that they had been focusing, and that they label that dysfunctional, and that they label him dysfunctional, I think, should I touch that or shouldn't I touch that? I better don't. So this is a period, because they are talking, in which I can think and not act. I can take decisions. I decided I will not label him. I will dislabel him. But I don't want to dislabel him and label the mother, because she's the other one that had been labeled. So I enter into a selection of how can I do the job of taking away the labels and offer alternative labels, ones that give alternative ways of functioning. So at some point then I said to them, you know, I just don't understand. What are you complaining about? You have something that is functioning. That, in the beginning, that is a trial. I really don't know if that is a good way of approaching it or not. I expect then what's the response. It seems to work. So instead of searching for another way of entering, I continue with that, tell me what is your problem, because this is a rather verbal kind of family, and this kind of mild challenge activates them. In other families, that will not work at all. And then and it will be very, very fast. They will tell me that that doesn't work. This is a very verbal family, and so it works. So then he begins to talk, and I know now that he talks in such a way that, and that's how it goes. It's a process, it's a dialogue, it's a trial, it's errors, that kind of thing.
Okay, well, thank you for a very good answer.
Yeah.
I was worried about the boy in the end when you were sort of like trying to get him away from being, it seemed like, the IP.
You will need to. Why don't you? Let me tell you first. I will appreciate one thing. If when you address yourself to me, you do not say, I am worried or I am concerned. Say your statements without saying that you are worried or you are concerned. Okay? Now you can say your statement.
Okay, I was wondering why.
That's fine.
That's
perfectly okay. If you're wondering, you're wondering. But you don't need to be worried. You are here.
I was wondering if you were concerned at all about whether the boy would be able to give up some of the, it seemed like he was in a position of having a lot of power with the family.
Yeah.
And I was wondering if you thought the boy was capable of giving that up and how that would happen. I mean, you disidentified him, and that seemed to be a way of doing that, but would that continue after you left?
You know, that's a generic question. And the question is, and it can be applied, somebody else probably has in its mind a question that starts, I am worried about the position of the mother. And somebody else probably will say, I am worried about can Andrea do something like that. And that's my generic response to these kind of questions is always, I am never worried about that. People have alternatives. And so this is a universal. People have alternatives that they are not using. You have alternatives, I have alternatives. You function. Do you have a husband or a boyfriend? You do. And you function in other areas differently than you function with your boyfriend? Yeah, of course, that's true for everybody. We always function in some way related to specific context. And in some contexts we are more competent than in others, and so on. So it's always possible to develop and to enhance and to make and to potentialize alternatives that people have and they are not using in this particular circumstance. So with that kind of idea about people, that people are not infinitely expandable, but they are expandable, they have alternatives, then the question is how to tap them and in what way to establish. You see, the advantage of family therapy over individual therapy is that you can create context. When I said to him, you are a teddy bear and you don't want to be a teddy bear, I am saying that in a stage that is a stage in which there are other 4 people. When I said to Bob, you know, you need to be thankful to Jeff, I am saying that in presence of Chris, Andrea, the mother, and the father. So one of the things that happen is that you are never talking to one person. You are always talking to a context that is movable, and it is in movement. So I said to the boy, I don't like you as a teddy bear. Now he understands that that's what I said to him. Now at 13, he feels being a teddy bear is not, is uncomfortable. So I was really offering him, at the same time that I was putting him down, I was offering him alternatives. Any question? No? Yeah? Go ahead.
The transition to the couple was so quick. I almost felt like I missed what happened. Can you talk a little bit about how you got into the made that
I
move?
didn't think that it was quick, really. I thought that
Well-
it took a lot of slowly exploring and making some kind of assessment that really the kids have something that was going among them that was workable. You know, certainly the two, what David and Bob were having was workable. What David and Jeff, what Bob and Jeff was having was workable. I was looking at the fact that these people, not only was it workable, but regardless of what the parents were saying, their perception was of an ability to cope with each other and to use each other's resources. That was quite extraordinary. I was impressed with that. And since I was impressed with that, and knowing that in blended families, the achievement, the arrival at a functional sibling subsystem takes a hell of a long time, then I assumed that these parents, in their complementarity, were doing something that was good. So then I said, okay, now then it was then that I moved Jeff out. But that was probably well into the 50 minutes into the hour. It was quite long.
How about just process-wise, if the kids weren't doing that well, or however, how do you think out that transition?
Well, you see, the first thing that I came was to a decision of not dealing with the dysfunctional dyad mother-son. That was one area that I was not going to underline, since that is the area that the family had identified and that you had been working with. Once I had decided that this is not the area in which I will enter, then it becomes a question of what other areas, in what other way can I enter? And that, again, becomes a question of trial and error. You make decisions that are small decisions that gives you an opening for an alternative possibility. And this is continuously a process of dialogue in which you are being moved by the way in which the family responds to your entrance, to your movements. And they control you, and they tell you, or at least they tell me, I become as dependent on them as they become dependent on me. We begin to dance a dance of probing. That's it. But I don't think that I went very fast to the couple. That was not
No,
my
I didn't
experience.
mean exactly fast. The change was sudden. For some reason, I didn't see it happen. All I saw was it. I didn't see you change places. I just saw all of a sudden it flashed, and there you were sitting by them.
Well, I
So
probably beamed. Yeah. Go ahead.
I presume by now in the wonderful work that you do that you have a way of reflecting far ahead, and I'm wondering what your, excuse me, educated fantasy is when the family comes back to Valerie. What do you imagine or fantasize that they will be like?
Well, my fantasy in this situation is irrelevant. It's Valerie's fantasy, the one that is useful. So I am leaving. You see.
My fantasy is that the couple may have learned that there's a lot more to their issues than they're in a lot of denial about the spousal issues, and I think that some of the denial will have been diminished, and hopefully I'll be able to just, continue to work with that part, with that subsystem, and, without more, as much resistance. I've had the resistance from my part was trying to hook them in and convince them that they had some stuff going on that needed to be looked at. So I think some of the denial may have been diminished.
Why do you say denial? You see, it seemed to me that these people have an idea
I see it as denial in terms of them not having thought it was serious enough to work on. It's like things are bad, but not bad enough for us to really go to therapy about.
But you see, I said to them that they are normal, and then they convinced me that they have some problems that they need to work with. In the sense that, when we are talking about denial, they came to say, I said, how would you like, in the best of all worlds, Candid, what would you like your husband to be? Mm-hmm. So she said. Then I asked him, and how would you like your wife to change? So he did. Then he did it in such a way that I said to him, gee, it's extraordinary how you precept her. And then, and do you want to change that or not? And she says, yes, I want to change it. And I said, are you certain? Because I don't want to spoil your fun if you want that. So I was working continuously with the complementarity of these people and with the fact that I think that they are one. And the man came out in the end with a rather nice statement. He said, should I change myself, or are you saying that I shouldn't do anything till she changes me? And I said to him, you cannot change yourself. And he says, okay, I got you. So that it was a question of treating them as if their functioning is always as if they are a unit. What I did is to say continuously that they are one, and that therefore whatever happened with Jeff was that at this point they all three were one. Whenever I selected a unit, the unit was one. It was composed by 2 people, by 3 people, by 4 people. But at the point in which a unit was created, this unit, these 4 people were one organism. These 3 people were one organism. And then it is a question of how this organism cannot change unless they change each other. So it is, and this is a technique to work with couples and with threesomes or whatever it is, that I think probably does not go very well in California, because it goes against the ethos of I need to change myself. I disavow people from that task. I said to them, you cannot change yourself, but in this unit, then the other family member can change you. And when he said, okay, I want you to be differently, I said, you cannot, that is against the rules. The only thing you can do is to change her in relation to you. This is, and if you use this technique, you will find out that people are a little bit surprised, but if they are bright like these people, then they, like they say, I get you. You know, they probably are, they had all gone together to Est, I am sure of that.
I'm trying to map the family, and I can see where the wife is getting her needs met through the son rather than through her husband. But I was also thinking, yeah, but most the lovingness and probably being on the same level as the husband. what I was also thinking that how about having the son and the father be involved in some kind of task so as to diminish the myth that he is such an ogre, that he's unapproachable, and for the mother to be relieved of the being overly worked parent, for her to do something for herself.
Well, I want to admit that in Philadelphia, that's the kind of thing that I would do. But here the feminist would say that this is a male-oriented intervention, so I didn't do it. Yeah.
I'm wondering if you think that this is now an opportunity to change the unit with which you are working, and how you would do that.
Valerie, that's what you...
Yeah, I can see how I can find a way to, terminate my individual connection with the mother by saying that, it's obvious to me in the consult that she's ready now to deal with her husband and that she really wants to do that. So I think that I won't have any problem stopping the alliance with her.
Valerie,
Yes.
do you want that to happen or not?
Yeah, I do. I've been wanting it to happen.
So it will happen.
Good.
You just said to her that that's what you want. You don't ask. You said, since you are a therapist and they pay you.
Right.
And you have a contract because they pay you, so you have a contract. And this contract was a contract that you established, in which you said, I will see you once a week, and I will see. Now you said, I see things differently, and that is the way in which I want. Okay. They come because they want you to help them to organize themselves in ways that are conducive to better harmony. So it's a decision. This is what people expect from us, some level of efficient expertise. And they want us to tell them that, at least in this area, that's the way in which I work. So it is democratic for you to be an expert. Any other question? Yeah?
There's been a lot of joking about California.
I cannot hear you.
There's been a lot of joking about the California family, and one of the things I think of you as being famous for is working with minority and disadvantaged families. This really isn't a question directly related to this family, but just the issue of AAMFT addressing that and CAMFT addressing the fact that California is not represented by the people in this room. And I'm one of the, I scraped together the money to come here. I see that as a great value to try to apply this work to people that aren't usually seen in therapy in expensive offices in Marin and other places. And I just wonder if you're still concerned with those groups and those issues, and also just the fact that California is Indians and a lot of people that aren't in the room. And are you still concerned in that way?
Well, I see that you are concerned with them, and that's good. I think that one of the things that probably AMFT is going to do with these tapes is that they probably, I'm saying because it's still not decided, that they will rent and sell these tapes, and the product of that will be to give fellowships to minorities. So that's one of the things that I think that they are deciding. That certainly is an important issue. Clearly, when I am talking about the California ethos, I am talking about the one of middle-class, white, therapy-dependent kind of. But
We live in Santa Cruz, by the way.
okay. Yeah.
I'll try and talk loud. This morning, your talk on the generations of family therapy, quite interesting. It's been wonderful that you put your work on tape through the years so we could see it develop and evolve. How is today's interview different from one 5 years ago or one 10 years ago?
I had changed my style in the last, I had evolved and changed my style. But this kind of family, I probably would have treated very much the same way 10 years ago. In general, I had moved to be a much more relaxed, soft, more use of humor, and a soft authority. But I can create intensity, and I can enter into strong conflicts with family members. My style had moved from being more confrontative to use confrontation in a different way. I think that therapy is always a challenge. I really do not see any possibility of changing people unless one creates some kind of stress, some kind of crisis that by which you help people to make unavailable their usual grooves, and they need to enter into a period of confusion, and out of which there is a search for new modalities, for increased complexity in the way in which they relate to each other. So all family to me is a family of challenge and a therapy of challenge and a therapy of crisis. I had changed in the way in which I challenged. I did not change in my orientation. My orientation is an orientation of creating conflict, increasing intensity of disagreements, producing cleavages between people, and creating situations in which the old blueprints do not work anymore. I have that way of thinking for a long time, 20 years. I change the way in which I make that happen. Yeah.
To follow up on that, do you think you've become more strategic? And if so, how was that manifested in this tape? And if it wasn't manifested in this tape, and if true, how is it manifested in your work in general?
I think that I am more strategic, I am more structural, I am more Milanese. I think that I am less of all of that. I think that I see myself today much less dependent on boxes, and that I think this happened to all people in the measure in which they become experts. They tend to expand their repertory. Sometimes I hear voices, sometimes I don't. This family is one in which I didn't hear any voices because it was very simple how to work with them. This is not a family that presented difficulties in my movements. If they would, no, it's not true. I hear voices. I did hear voices. When I did not take the position, develop the strategy that you said, I heard voices. I had been the day before yesterday in the feminist group, and I heard people saying that thing that Minuchin is a male-oriented therapist that always uses the child, the father, to separate mother a child, the thing that you said, and I decided not to do it. So you see, I did, in this situation, I use an alternative. Some thing was blocked. Yeah. Yes, but do you want, please? Sure. Excuse me.
Well, aside from any of the joking level, I think this is a good forum to explore a little bit the issues that come up about whether you're, and in what ways your therapy is sexist. And I would like to ask the audience if we, in the spirit of really just exploring this, whether there are some feminist therapists here who would be willing to talk a little bit about the way they saw this session. I think if we could be concrete and hear some of the associations that people have to the ways in which therapy moves when you work. Is this an example of what people mean when there's an attack about male-oriented therapy? Is this an exception? And could we explore it a little bit?
Thank you. We always work like that.
I don't know, maybe I'm a rescuer at heart, but I'm glad you brought that question up, because in going to various workshops throughout this conference, I, for some reason, maybe being in school, have gravitated to the workshops in theory and research, and have been amazed at how male the audiences and the participants, the presenters have been, and have sort of gone through this this workshop feeling sort of angry that you know, the big ideas are still being developed by all male. Pardon? All right. Whatever. Yeah, that's true. But I'll tell you something, that today at the plenary session, I was very pleased to hear your presentation, Dr. Mnuchin, and also to, in a sense your openness, because I was also at that feminist conference, and I heard the same, you know, comment that you referred to about sort of the problems that have come out of systems theory, and how so much of the interventions seem to sort of, you know, pull mothers and sons, or mothers and daughters, away from each other, and the job that mothers have had for so many years are sort of usurped by the father with these traditional interventions of moving the father in and moving the mother out. I was pleased to watch this session today, because it's my sense that you seem to be open to this criticism of structural family therapy. And I would like to see more of that openness among other male therapists, because I think that changes need to take place in the field of family therapy to elevate women. And I saw it happening, and I think that your way of joining with his family took into consideration some of these feminist views that are impacting on the field, and I just hope to see more therapists doing something with that. The Family Networker article, I guess a couple months ago, on women in family therapy was really excellent. I think it pointed some of these issues out.
Yes.
What I see in that, when I said the other alternative to have a dyad is the father and son, and letting the mother be relieved of her chores of a mother, and for her to expand herself, I don't see that with the father and son joining together as something that is disregarding the woman's role in the family, because I feel that she has been put in that role where she's supposed to be the mother, and the father is the breadwinner and the big macho coming in. So I'd rather see that the mother develops herself as a person away from being motherhood, and that will alleviate a lot of the problems that is having in the family.
I agree with both of you. You know, it's a very interesting thing, because I think that system thinking is a model of looking at interrelationship between people that is a formal model. You know, system thinking can be used to understand the blood sugar in the organism, can be understood to deal with mathematical symbols, can be used to understand families and so on. It is not the model that is at fault. It is the particular way in which you use it. So that I think that when you use system thinking to deal with abstract symbols, then you have a freedom of replacing A by B and making C equivalent to D and all these things. When you're dealing with people, that is impossible. So you deal, and when you are working and you're producing changes, then you can think systemically, but you are always working linearly, because you're working in a time dimension, and so your interventions are sequential. So your thinking is systemic. Your interventions are interventions that go in the only time that you and I have available. And then your sequences are, you put this son in contact with the husband, and then the mother has some freedom to expansion, and then other things happen. And when you accumulate all these linear movements, you have a system intervention of change, So that the idea that system is berserk, that Marianne said in the meeting, that system thinking is berserk, I think that is an incorrect way. I don't think that the feminist position is, or the idea of looking at families as ideological, in an ideological way, is contrary to system thinking way of looking at things. So, but this is something that it's not for this meeting. We are supposed to talk about this particular family. This is a meeting about therapy, yeah, or about this particular session.
Dr. Mason, I have one question. How long would you take before you ask them to leave the teddy bear at home and just come as a couple?
Oh, I really do not think that it's necessary to work with this couple alone to achieve that change. I actually think that you could work in a variety of subsystems, and I think that one of the subsystems, one of the ways in which you need to work, is to include Jeff, so that you can change, so that he can change his participation. He needs to be, I really feel that kids should be included in the sessions. They provide a tool to modify. So probably with this family, I could have some sessions that are just with the couple and some sessions that are with all the family. And what I would change would be the individual session with the mother. I think that at this point, that is an irrelevant way of working. But your selection of what units you will have, I could vary them. And sometimes it could be 5, and sometimes 3, and sometimes 4. And I could keep them shifting. Yeah.
When you turned to the couple in the session, you talked with them about changing their ways of behaving with one another, and I heard you say, if you want to, and the way that sounded to me was that you were utterly confident that they wanted to. What about when they don't want to? I mean, do you ever take no for an answer? Do you ever get to the point where...
I take no for an answer for a while.
Uh-huh.
It means it's, if I think something is correct, then I come to it from a different perspective. But, you know, a lot of my statements are provocations. So when I said to them, I don't want to spoil your fun. It is a provocation, and she knows that it's a provocation. When I said, if you want to, she knows that I don't mean that. And it is a probe, it is a push.
Mm-hmm.
And it's not that I am convinced that they want to do it, it's that I am taking them in a direction of wanting it. It is that, okay?
Yeah, I guess what I experience between myself and some of the families I work with is that when I begin to push in that way, that 6 sessions later, I'm still pushing harder than they are for change, and but that's a trap.
These are things that you learn how to push more effectively. You know, it doesn't come, it is not something that that one is born with that, you know, because the truth is that in life, we are trained toward a certain direction of politeness and polite behavior and what is proper and what's not proper and so on. As a therapist, you are really you are challenging, I don't know what's the word, you are challenging the rules of functioning that you had been training with. So it is difficult. You need to feel comfortable that your point of view in this particular contract is the one that you want to make happen. You need to feel comfortable with your authority as an expert. And you need to feel comfortable that if you push and they resist, that's correct. And it means just that you don't need to abandon your idea, you need to make it more efficient. I tend at this point not to enter into any power operation. That is because people experience my authority because I had been using my authority for so many years that I feel very comfortable with it. It will be much more difficult for you to do that.
Would you talk more about when you first did the intervention of telling them that they could only change each other's behavior and that they couldn't, that when he said, I want her to be different, you said that's against the rules, that it's changing her behavior in relation to you. And I thought that was a paradox in the screen, but then when you talked about it here, it sounded like that was specifically this idea of creating them as a unit, and I am a California therapist, so I do have, I'm confused. If you could just elaborate on that a bit. The other thing in regards to that is when, at the very end, when he said something about this, and you sort of cut him off and got up and shook his hand and said, well, I think that you need help with that. You can't change on your own. I was wondering if you did that simply because of time or if that was specific to sort of cut off his intellectualization about it.
Let me just use this you need a micro. Okay. So that's a yin-yang, and we will call him he, and we will call that she, okay? Now, so who was the person that asked that question? Yeah, you. So, you know, you can say he is one, she is one, okay? If he is one and she is one, you ask him to change himself, you ask her to change herself. I never do that today. I said to she that she should change him. Now, if he plus she are one, then the only way in which she can change him is let's say, that way, or that way, or this way. That means she needs to modify her own behavior in relation to him, since she is his context, and he and his context are a unity. Okay? Fine. Okay, yeah.
You wouldn't look at it that way with a mother and child, would you?
Well, you know, really, this is just a simple device. It really is a way of talking about complementarity. It's nothing different. You know, this is how you talk about complementarity. And so I would say to a person that has a behavior, let's say, I did say to Jeff that has a behavior, that your mother controls your behavior. So I said to him, you are a teddy bear, your mother is making you a teddy bear. So that in that situation, I am making the same statement. It is the behavior of each one of the family members is controlled by the way in which the other family members position themselves around the person that owns that behavior. That's why we go into family therapy, because we believe in that. And then what you do is to intervene in such a way that you change the total organization and the symptom bearer. And the symptom changes because the position of the family members around the symptom bearer had changed. In this situation, the symptom bearer is Jeff, but when the session finished, the position of the family members around the symptom bearer had changed. Therefore, the symptom had changed. Yeah, I think that, okay, go ahead.
I appreciated your focus on normalcy and on normalizing a lot of what they were doing and normalizing the strengths and the way the kids were coping and stuff. And you talked about you create splits and conflicts, and it seems like that redefinition was one of the ways of creating a split between the way the problem is identified and the way it happened at the end. And I've seen you do those interviews in London where you were interviewing families, looking for healthy families, for the normal stuff. Could you say some more about that and how that affected what you did here, that trend in your work?
Well, looking at divorced families, blended families, we are looking at these families as if they are normal families in transition. Transition is a period, that's the kind of thing that Pat should talk, but I will talk today instead of. Transition is, these families had been functioning in a particular way, and they were two units, they blend into one unit, and they go through a period of trying to find ways of an organization that is functional. This period is a period of confusion, trial and error, pain, anxiety. If the therapist during these transitional periods acts as if this pain, confusion, anxiety is normal, and it is the process of searching for more complex ways of organizing, then you are helping the family to create easier the creation of a way of organizing. If you do, like many people that are working with families of divorce, if you tend to label that period of trials and errors as really pathology, then you help them to crystallize themselves instead of evolving more harmonious ways of being. Is that something like that? I tell you something, I think that we had gone till 3:33. that seems to me the exact hour to finish. So let's finish.